Hi, this is Unlimited Access. My name is Levi, and I'm here with Shannon.
Oh, hi, Shannon Aylesworth, founder and CEO of MyHealthHatch.
Shannon, so we've been talking a lot about a lot of different things, but today we want to talk about patient engagement and the experience of the patient, how that all works out, and specifically how it interfaces with an app and that whole aspect. So why don't you just quickly describe what is patient engagement?
Yeah, patient engagement is really the goal of the medical community is that patients are involved with their care. So it's you taking an interest in your health and owning your piece and making sure you're healthy. And that can be more than just, they say go on a diet, are you treating yourself well? But not just that, but your history of health. If you've had back issues, are you looking at things to enable yourself to get better? There's lots of preventative things. We have a big crisis on our hand, too many people getting sick, because there are things that we can do to prevent us from getting very sick. So they really want you to engage with them in making a plan, and it's small changes. It doesn't have to be huge changes, small things, eliminating sugar in your coffee, or, for back issues, and I know this personally well, certain exercise that I can do that take literally 5 minutes in the morning for me to prevent, having pain. So patient engagement is about you figuring out and engaging with your doctor, your care team, what's going to make you healthiest in the long run.
Preventative health. Got it.
And or if you're sick, again, managing your sickness, a chronic illness, managing your sickness so you don't have an acute issue.
Right. So how does any app, really help with patient engagement?
Sure. So there's lots of different levels of that. A good experience is a simple one I'll talk about is like a water intake app, just something that can track what you're doing versus what traditionally we've had to do is you have a notebook and you write down the things that you do that day. An app just automates it for you. So, hey, I had 4 glasses of water today. Tomorrow I need to do better and do 8. It encourages you. It incents you. It motivates you. There's lots of apps out there now that give you money. People are probably going to ask me, what app is that? But you can earn points and you can get rewards to do good things for your health. And so it's really just helping you track and be accountable.
Now, what features should patients and caregivers look for in an app?
So that's 2 different things. Patients, in particular, it's going to be looking for tracking and accountability. Motivation, I think, is really critical because, again, we all know we should do better. We just don't do it because until it's like out of sight, out of mind. If you don't know if you're not accountable, and it's proven over and over in programs, and I've done it myself, like Beachbody is a big one where they do accountability partners because you have to own up to it. You have to see what you're doing. It's easy to forget that. So from a patient engagement perspective, you should look for motivational accountability, data that you need in order to track yourself, connections with other apps. So you could have, 10 apps and you're trying to do 10 different ones. A great example is like MyFitnessPal is integrated into your Fitbit app now. So you can track how you're eating and how that makes you feel during the day and what motivates you to move more. So that gets a little bit more sophisticated, but it is what you're looking for. And then caregivers look for ways that they can see that data. So for me, my dad, I gave him a Fitbit and I linked to his Fitbit so I could see, hey, are you doing 2,000 steps today? That's awesome. See if you can do 2,500. So that enables me to be his accountability partner and cheerleader, more so than accountability, especially because he's 78. So him get 2,500 steps is a big deal.
Yeah. My daughter works in an Amazon warehouse and gets like 20 to 25,000 steps.
Yes. And you can, at some point, you can't beat your own number of steps. So you have to start setting like new goals, like, did I walk at this time in the day?
I saw some like YouTube where this woman did like 100,000 steps. She just started at midnight, went for 24 hours.
You could even see
Some
that.
sort of horrible thing. Well, are there any... It's horrible. Are there any risks associated with, patient engagement apps or maybe things that we should be aware of?
Yeah, I was just reading that. I was just trying to think about what's a good risk, not a good risk, not that you want risks. I would say there's a risk for demotivation. And I found that with my dad. Again, my mom and my dad, if I expected too many steps. And what I loved about, I use Fitbit all the time. I love that you could have competitions, but you could change what your competition was for. So as an example, Fitbit had, you can either do a percentage of your goal or number of steps. So I would do, and my mother, I gave her one, man, she kicked my butt in number of steps, but my dad has a bad back. He's had 4 back operations. So he could do 2,000 as his goal, even though my goal was 12,000. And he'd be at like 200%. He'd be running around 2,000, doing 4,000 steps, get 200%, kicking my butt.
Right.
So I think there's risk of demotivation if you're not meeting your goals. And that's one of the big things that people are saying now is progress over perfection. Don't set huge goals. Small goals are good. So accountability, the backside of accountability is, oh, I failed. And that's not the goal of, everybody fails when they're looking at, when you're looking at, hey, I'm not hitting my number. So I think that's probably the primary risk of it.
All right. Well, let's just talk about what we're doing at MyHealthHatch then, because with all the opportunities that exist with patient engagement and a healthcare app and or the potential challenges of maybe demotivation, what are we doing at MyHealthHatch?
So our first our theory behind patient engagement is specifically connected to how do you baseline yourself from a health perspective and build from there. It's very demotivating when you're just sick all the time and you don't know how to fix yourself. And so you go into the doctor and you say, I need help. And they say, well, what are your numbers? Well, I don't know. Like I am cholesterol. I'll talk about that openly. I've got high cholesterol. I've had it since I was 16. That isn't what's made me tired recently. So our goal is to give you the baseline data and take that. We talked about getting medical records, but part of getting the medical records is also pulling what's relevant to you and helping you figure out how you feel throughout the day. And without that data, and that's what a lot of these apps are doing is they're having you input the data. So at a point in time, you start inputting. This is historical from MyHealthHatch. We want to do historical lab results. All of that stuff gets imported so you can see and go, oh, this is my baseline. This changed. And there's lots of knowledge and education. And this is where the education piece comes in, is we then connect that with, oh, you have low vitamin E. It's not that it's not like, oh, you have low vitamin E. It's life altering. It just happens to be something like I'm low on vitamin D. It happens to impact how I feel during the day, how motivated or how unproductive I am. So our theory kind of is everything starts with the data and getting a complete set of data, which most of the apps out there today only do that particular instance, right? Steps, drinking water, food apps. We're saying put that all together so you can look at that collectively and then figure out how to move forward. People spend way too much time trying to get the data. By the time they do, they don't want to take action. Right. So we're kind of the unsexy part of collecting the stuff so that you can then take action.
It's, it's just so important because it's our health.
Yeah.
Right. And it's just all over the place right now. And we've talked about it many times. And I'm just really excited about what we're doing. And we're getting close to beta. In fact, we might talk about that in the next episode here. And kind of what's going on within the app. So let me just wrap then for everybody. Hey, at MyHealthHatch, it's about having all of your health info in one place with the education and the resources to support your knowledge toward that information. See, we believe that people make better health decisions when that medical information is right at their fingertips and they're able to access it right away. So thank you so much for watching our show today.
Thank you so much. Look forward to the next one.